Are you also looking at other locations throughout the Adirondacks as far as opening more health centers?
Yeah, the network certainly is in a period of growth. We have done very well with finding the right partners across the region to modernize and improve our facilities and presence, footprint. So I think there's probably lots of good opportunities for us to continue to do more work. More and more we realize that you can provide the best healthcare in the world, but you've also need to extend into things that we call social determinants of health. So, we need to probably get more involved with things like housing and food and transportation and more advocacy for the people that live here. And because I think if we wait for someone else to solve these problems, it may be a very long wait. But if we get the right organizations, leaders across the communities, we can do some great things here, and that's our hope for the region.
And we've seen some of those programs starting in Essex County and down in the Glens Falls area where there's really a push to get people to eat healthier food.
Correct.
Prescriptions are being written for fresh fruits and vegetables, and then sending folks out to farmers markets to try to get a healthier diet. So you're looking at programs like that as well.
Yeah, definitely. We had a pilot program at our West Mountain Health Center in Queensbury, where we've partnered with our local food sources to bring food into the health centers, and it's really amazing to see folks picking up food in the waiting room, and with that getting instruction on how to cook the food. Inevitably patients bring their kids with them, so I really know that this is impacting families, and we do have a rich agricultural base here that it just requires kind of thinking outside the box, building links, and we really feel that Hudson Headwaters is in a great position to explore these things, and so far I've seen some really nice outcomes. But I think we have a great opportunity here because we all recognize that we need each other, and we don't have a lot of excess care here. So more and more we are working closely to figure out solutions, figure out what we can do where, and what the needs are. We also have an aging population in our communities, and especially in the Adirondack Park, and those folks over time are really going to need pretty robust care.
And is that a crisis of its own right now, finding staffing and home health aides and help finding the care needed for that aging population?
Yeah, definitely. A couple of approaches though. We feel that we're going to need to use technology more. So, can we use video technology to bring providers into more remote areas, using our health centers as a hub? So can we bring some of those resources, especially around psychiatric care, into some of the harder to reach locations? But staffing is always a challenge. We, Hudson Headwaters has between 800 and 900 employees, and some of these jobs are in pretty remote locations, which are, I think, good jobs, and so we're certainly not the biggest provider of employment, but we're a significant provider of employment and economy across the North Country around healthcare. So I think there's a great opportunity here for people to have sustainable jobs working in healthcare. Finding physicians, nurse practitioners, and PAs is a real challenge, but we've made some great gains on that with partners at Albany Med and University of Vermont and others, teaching both medical students, but also here in Plattsburgh, working with the hospital to help launch a family medicine residency program, which is a huge resource to the region, and we'll soon be graduating 6 graduate physicians a year, and so that offers a great opportunity to try to keep people here who have trained here, and meet the needs of the population. But it was really the partnership across organizations that took ownership of that problem. We knew we were going to have a huge crisis, and we've successfully addressed that, certainly in Plattsburgh and surrounding communities.